Good morning, friends. I'm Dr. K. Prabhakaramurthy, narrating you about my experiences in homeopathic cases. I am going to tell you about an interesting case of encephalitis. It is usually called brain fever. Actually, so many people give medicines, preventive medicines for brain fever, encephalitis, Japanese viral encephalitis. But I have treated some interesting cases when they are suffering with this encephalitis. That is important here. This has happened in 1981 when one of my patients was traveling in the night towards Vizag. One couple are carrying their child in a helpless condition after having got treated with some pediatricians and in the general hospital in Elur. They are returning to their home village. This good Samaritan told them, why don't you try with homeopathy? It is having a good chance of recovery with the homeopathy. This couple told them, we have lost all the hopes and we are taking back the child to our home. But yet this good Samaritan told them to try with homeopathy with this doctor. And the next day they come to my clinic in Elur when I was practicing in Elur in 1981, sometime in April or so. I have observed and it is looking like a hopeless case, no doubt. But I wanted to see the patient very closely and observe the patient. That's why I have converted my clinic was only having outpatient department. I have converted this waiting hall into two pieces and arranged them with a curtain and two benches for the benefit of that patient. And I kept that patient with me as inpatient for 15 days. And I started the medicine straight away with bacillum 1 m, only one dose. Why? Because this is related with brain and nerves, and when it is related with lungs and respiratory system, tuberculum is the choice of the good nosode. And when it is about the skin, psoriasis or anything like that, this sorinum will come into picture. That is how these three medicines were differentiated by our gurus in our college. So I straight away gave this patient bacillum 1 m, and by 3 days or 4 days I have been observing this running of the temperature by way of preparing a chart. Once in 3 hours I used to observe the temperature and note it, and in the meanwhile after one day gap I have started giving Bryonia 30 as my trump card for this medicine. As this patient cannot tell anything, in number one, cannot express any symptoms on her own, and this is very little child. So in the chronic fever cases, I used to start with Bryonia. Where if it is in the acute condition, just arise from 1 or 2 days only, it may be belladonna, or if it is arose only few hours back, it will be aconite. Like that I have given the child Bryonia 30 in first place, and later after 2 days I raised it to 200 in graduated doses. Graduated doses means mixing this 200 potency 1 drop in half glass of water and stirring it anti-clockwise and giving 1 spoon every 3 hours. Like that the story has started. and the temperature has relatively come to normal, and this patient is having occasional contractures or conversion like thing. She is to bend backwards like that, and I did not go for hypercam or anything. I stood with Rayonium only. As the temperature chart is revealed, this temperature is mild in the morning times, and it is rising to 104.5, 105 also sometimes, and it is going on like that. So I have stick to next lycopodium. After 1 week, by that stage, this temperature has, after giving lycopodium 0 by 5 in 50 millismol potencies, daily I used to give 5 to 7 doses, 1 spoon water after stirring anti-clockwise for clockwise the solution for about 15 to 20 times. Like that it has happened, and luckily this patient has got relieved of the fever by 12th or 13th day, and started taking some food without any vomitings or anything like that, and this patient is also sitting posture, and later after 2 weeks by 15th day or so, we made that patient also to walk, and she has also walked, and after 15 days I relieved them from the clinic, from my temporary nursing home, and they went very happily, and the patient continued for continuously in touch with me up to our fifth or sixth year, and all these problems have solved, but some limp has remained in the right foot, that we cannot succeed. Like this, we can do good service to the patients, not only just by giving these preventive doses, by taking active cases of encephalitis also, and the after effects of encephalitis also. I have treated some more cases. This is one of the best cases I have treated. I remember it very well, and I remember it for my lifetime. And I thank you very much for your patient listening. We will come up with another case in the next episode. Thank you.